Welcome, everybody. Welcome back after a hiatus and a new year to our webinar series. And I'm Dara Lee Lewis. We've got Sydney Solom and Allison Kelly Hedgepeth, and of course, our very own Dr. Charles Blatt, who we are delighted to have today to talk to us about stress in the heart. And Dr. Blatt is going to present a brief slideshow, and then we're going to have a conversation and take questions from the audience. So as we always do, we'd encourage you to enter any questions or comments that you have into the Q&A. So if you put the questions in the Q&A, we'll have time at the end to discuss them. So is it okay if I call you Chuck, Dr. Blatt?
No.
With your gray hair, I know that I need to show a lot of respect, which I have, immense. So Dr. Blatt, one of the founding members of the Lown group, Chuck, you've been doing research on stress in the heart for many decades, and can you tell us a little bit about how you got involved in studying stress in the heart?
Sure. I actually started this, my career started my career studying stress in the heart started between my first and second year of medical school. And I had heard of Dr. Lown from the fact that we grew up in the same little town in Maine. So I'd always heard of this great doctor. And so when I got into medical school and had the opportunity to do research, I thought, who would I want to do research with and learn from more than Dr. Lown? So my first summer, I started off on a project that involved the interaction of blood pressure and heart rate. Now this is a reaction. We know that when blood pressure goes up, the heart rate tends to go down under certain circumstances. And some would think that, well, if the blood pressure is up, if you're stressed and your heart rate is up, both would happen at the same time. But there are actually more complicated aspects to this. And we were trying to see whether there was something about the reflex that we know exists between high blood pressure and drop in heart rate. And it turns out that there's a reflex mediated by the brain, started by a little bunch of nerves in the neck. And this is the aspect that I first studied. So we did this in animals, thinking that maybe we could then apply it to people. Then I got interested later on when I spent 2 solid years in the laboratory after my third year of medical school in what was going on in the chemistry of the brain and how it impacted the heart. And the work was on chemicals that I think most people now are quite familiar with, but in the mid-70s, they were not very familiar household names. And these chemicals are serotonin and melatonin. And serotonin is a very important has a very important role in depression, it turns out, and anxiety, because the common drug called Prozac was the first developed, and it affects serotonin in the brain. In fact, one of the experiments that I did in Dr. Lown's laboratory at the Harvard School of Public Health, I was able to obtain from Eli Lilly, which had a compound which was just a number, and it helped increase serotonin in the brain. And I got this compound, and it was called fluoxetine, which became Prozac. And I used this compound and injecting it into animals. And we were able to measure certain aspects of the chemistry of the brain and link that up with what was going on in the heart. And particularly, we were interested in how the heart became unstable electrically, how people got extra beats, fast beats, sometimes very serious extra beats. And actually, it was the serious ones that we were most interested in. And we found, the hypothesis was that with more serotonin in the brain, that reflex that we first talked about would be engaged in a very therapeutic way. So it would take away some of the adrenaline, the sympathetic tone that causes us to have irregular and rapid heartbeats. So there's a linkage among all of these factors. Now, it turns out that serotonin is a first cousin to melatonin, which nobody really knew about then, but then it became a very important household term, and it's a way people get to sleep at night. So these are aspects of the chemistry of stress, and it's that I started back looking at, as many other people did, quite a bit ago.
Sorry, that was me. So it's so fascinating, and I know a lot of your early research had to do with the deadly arrhythmias and sudden cardiac death, but a lot of what you're going to talk about today is more the day-to-day palpitations, skipping heartbeats that might be more benign that many of our patients suffer from. So maybe what we'll do is have you go ahead and show your slides. I know you're going to talk a little bit about some of the research that you did, and then at the end we'll have a chance to circle back in here in a little more detail, because it's, you know, this is research that at the time was really groundbreaking, and you guys did some very important research that really paved the way for how we approach arrhythmias today. But please go ahead, and we all look forward to hearing your talk, and then we'll talk some more at the end.
So if I can overcome the stress of figuring out how to share my screen, there we go. Share. And how's that?
Perfect.
Good. Okay. Let me advance the slide. And there we go. So let's start by defining what stress is. Well, stress can be defined in many languages, of course. And interestingly, you know, everything comes from the Latin, and then moving on to, well, from the Latin, stress comes from strictus, which is tightening. And that's indeed what stress can, one of the aspects of stress is that we tighten up both our blood vessels and other parts of our body tighten up. The Old English distress, strict, and other aspects of the language. You know, we've heard of stress from ancient days. Now, we commonly think of stress as a source of anxiety, of worry, of feeling scared, and these are more common terms that we would apply. And in truth, though, the stress is the body's reaction to any change that requires the body to adjust or to respond. And these responses can be either physical, they can be mental, or they can be quite emotional. Yet, of course, stress is a very normal part of our lives, and we experience stress either from our environment, from our bodies. We have pain, we stub our toe, or thoughts can emerge that maybe from memories that bring forth stress. And the stress can be short-term, it can be long-term, and the effects of short versus long-term are quite different. Now, what's very interesting, and I learned this long ago, was that if you ask anybody, any lay person, do you know when you're stressed? They say, absolutely. Do you know what is stress? Of course I do. I know that stresses me out, or this. Yet, from a scientific standpoint, when we attempt to go and study stress, it's a very hard thing to get one's hands upon. It's like when you try to reach for something and it skips out of your grasp. And that's because in science we try to quantify, we try to measure, and then we're often trying to see whether we can change the effects of stress. And then if you think you are going to change something, well, you have to measure where it is and then where it goes. But that turns out to be an exceedingly complex and difficult thing to do, because stress from a physiologic standpoint, turns out to be very complicated. And perhaps I'll be able to shed a little bit of light on this, why it's complicated and what it involves for you. Now, I expect everyone to take careful notes on this because I'm going to give an exam. And that should cause you to feel a little stressed, threatened, but of course I'm kidding. What happens when we feel stress, when we know that there's going to be a spot exam from your days in school, or that you're driving down the road and you see somebody going awfully fast and they are supposed to stop at a stop sign and you don't know whether they're going to stop? And this requires a potential emergency reaction. Now, the stress response is mediated by a flood of hormones that are released that allow you to respond to this threatening situation. We all feel it as our heart perhaps pounding faster, we tighten up, breathing quickens, and in some respects, the beneficial part of stress is that it quickens your senses. It makes you a little bit sharper. You're quicker to see, is that person really slowing down or not? And is there some other problem that's going to happen? So you're really on edge. Now, as I mentioned before, stresses can come from an external source, like from the environment, of a strike of lightning, and then all of a sudden you hear a tree limb snap, and you see it, and you've got to run out of the way. You've got to get out of the way quick, and the stress response allows you to do that. Now, sometimes the fact that or the impact of a psychological stressor, like in a family situation, like a child's response or a spouse's response, can cause a lot of stress, or even social situations. I'm sure many of us have had a situation where you walk into a cocktail party and you say, "Uh-oh, what's that person's name?" And suddenly you tighten up a little bit. "Uh-oh, what's that person's name?" You can't remember the person's name. And you start to try to either avoid them or you figure out some way to manage. And so that's one of the common stressful experiences that come from social situations. Or if you're ill or you have acute appendicitis, you have to go in for an emergency appendectomy. Well, this is a very stressful experience, and so our stress responses are initiated from many sources. Now, many of you may have heard of this fight or flight response, and that is a physiologic response that is initiated by a stressful stimulus. And it's a rather complicated reaction that involves the nervous system and the endocrine system. And the fight or flight response is initiated by a very deep-seated structure, a very old structure that's deep within the brains of mammals, of almost all reptiles, birds. It's a very old structure that reacts to threat and communicates to another very old structure within the brain. And when I say old structure, it means it's been there a long time and it's evolved, and it's done such a period of evolution that it really it's sort of gotten things right. It knows how to react. Now, the hypothalamus is responsible for releasing adrenaline. Adrenaline then can serve as a means of stimulating the heart. It can the nerve signals travel down the spinal column to the heart, and then also down to the adrenal gland, which is a small gland that sits atop the kidneys. Now, the adrenal gland is responsible for releasing cortisol. So I've talked about adrenaline, which is the fast stimulating response, and then cortisol, which sets the body up for a more longer term response to stress. And on the left side of the slide, several of the features we have talked about, the drying of the mouth, the tensing of the muscles, the sweaty palms. This is all part of the stress response that initiates in the amygdala, goes over to the hypothalamus, sends signals down, mediated by adrenaline down the spinal column, and all the way down to the adrenal gland. So it's a complicated physiology. And it was worked out by this Harvard physiologist, Walter Cannon, who did all this work about 2 miles east of where I'm sitting on the Harvard Medical School campus. And this work took place in the early 20th century. Actually, this is a picture of me at Harvard College, but no, I'm sorry. This is Walter Cannon, who's the father of stress physiology. Now, what are some of the other psychological and emotional signs of chronic stress? Well, people become depressed, they develop anxiety, and some experience this irritability or restlessness, this feeling of being overwhelmed, sometimes unfocused, unmotivated. And either people respond by sleeping too much, or they have great difficulty falling asleep. Some people have this constant worry, this constant racing of thoughts, and memory can suffer, ability to concentrate can suffer, and one can make bad decisions. So these are some of the negative aspects of stress that we would like to counteract or minimize once we recognize them. As we talked, stress can help you get out of a dangerous situation, and it can put you in a dangerous situation by resulting in these chronic circumstances, this chronic anxiety or depression. Now, the other aspects that we deal with when stress is in excess and chronic is the fact that healing is delayed and may be poor. Many people recognize that irritable bowel syndrome, which is unfortunately a very common problem amongst us, is it can be mediated by stress, certainly higher blood pressure, and diabetes can be aggravated by excessive stress. Now, what are the causes of stress? I think everyone will not be surprised by the data that indicates that 72% of Americans find that stress comes from financial problems, and it's a source of stress within families, amongst individuals, amongst organizations. Now, the other major causes of stress, I think, are probably well known to everybody. Death of a loved one, a family member, divorce within a family, loss of job, moving locations, dealing with a chronic illness, or dealing with depression or anxiety. Now, interestingly, the depression or anxiety may have been initiated by the chronic stress. So there's this negative feedback loop that is important to interrupt. Now, what about stress and the heart, which was the specific area that I wanted to focus on? Well, there is good data that has accumulated that with an accumulation of stressful events, there's a higher risk of heart attack, a higher risk of stroke, and mediating a lot of this is the fact that under stress, blood pressure is high, which causes the other two. So when blood pressure is elevated, the blood vessels within the brain, within the heart, are affected. There's just too much, there's a lot of wear and tear and mechanical stress on the blood vessels that can result in the heart attack or the stroke. Or we know that stress mediates the sudden blockage of a blood vessel. Adrenaline, turns out, is responsible for the sudden, it's called a thrombosis of a vessel, a blockage of a vessel from unwanted bleeding that can be the source of an immediate, sudden, acute heart attack. Now, how much of a problem is this? Well, our group has been interested, as we've talked, for a long time on the very basic science of this. And then over the 1990s and early 2000s, we conducted clinical research where we followed many hundreds of patients who had come to us for another opinion on how to manage their coronary artery disease. And during that time, we devised a study, and we decided we would look carefully at both the psychological aspects of these patients, as well as their physiologic aspects. So the part of the protocol, part of the study that we did was to every year administer certain types of tests that measured depression and measured anxiety, and we followed these patients along over time. Now, the extraordinary finding that emerged was that when anxiety is elevated in patients, this is as important as out of control blood pressure, high blood cholesterol, or the presence of diabetes. So that this is an equivalent risk factor. So we all know how important it is to control blood pressure, to control diabetes, to lower cholesterol in patients with coronary artery disease. But it is also important to deal with stress, because stress leads to anxiety, chronic stress, chronic anxiety, chronic damage being done to the blood vessels. It's an area that I think clinicians are intuitively focused on. I think if they're good clinicians, they're very much focused on not only the physical aspects of a person's health, but the psychological aspects of their health. A good history, for example, really tries to uncover, a medical history tries to uncover the sources of stress. First, gaining a sense, is there a lot of stress? Is there more than usual? And then if so, what is really going on? And that is a very, very important aspect of clinical medicine that I think in our group we're very, very focused on and attuned to. We teach the medical students from Harvard Medical School that come and train with us, and their eyes their eyes are wide open when they see the time and effort we as clinicians take to try to uncover this aspect of what's going on with our patients. So how do we manage stress? Are there some easy things that we can apply when we recognize we're under stress? One thing is to stay positive. In fact, laughter, getting a good laugh, is one of the most stress-reducing aspects, or stress-reducing activities that we can get involved in. And it turns out that when you measure levels of stress hormones in the blood, as hard as that can be, but it was actually measured with laughter after a good session of laughter. And laughter is a very healthful activity, the result of which causes a reduction in inflammation in the blood vessels, can even raise the good cholesterol. Drugs, we know, don't raise the good cholesterol, but a good laugh can. So having this attitude of looking at things in a positive way and focusing on this can be very helpful if you can. Now, the other aspect that many of us recommend to our patients is a practice of meditation, which can be very formal, such as transcendental meditation, where you go into a formal course, you are given a mantra, you learn how to do this and you practice it. Or it can be such that you just get on your iPhone, your smartphone, and look up an app. One of the apps is called Simple Habit. You can just search it, and it gives you a very easy way to go in and go through a sequence of breathing exercises that allows you to generate a state of lower stress. And it can be very helpful in reducing blood pressure. Now, from my perspective, and many of my patients know how I focus on this, but exercise is probably one of the most effective ways to mitigate the bad effects of stress. And it can be just walking. You don't have to be a varsity athlete or go bananas in the gym. Simply walking can be one of the most helpful things one can do. And this has also been studied, and we know that there are certain chemicals released called endorphins, which may reduce stress, which can reduce inflammation within the blood vessels, and can protect the heart from some of the negative effects of stress. So I urge everyone to look at the very simple things that one can do on your own to reduce stress. Now, unplug. Many people make that a practice, either one day a week or one morning a week or even an hour in a week, to just turn off their iPhones, not to turn on CNN or MSNBC, or not to look at their Apple Watch. Just stop. And it's not something that needs to be done for a long time, but if you can just take yourself away from constantly reviewing emails, constantly looking at news feeds, this can be of great importance in mitigating the negative effects of accumulated stress. Now, basically, each of us has to figure out our way of mitigating stress, just as I mentioned how each of us knows intuitively whether we are stressed or not. And we don't need to have chemical tests to test our blood to determine if we're stressed or not. We know it. And people define their own path. Listening to music, getting lost in a book, going out for a nice walk while listening to a book or music. These are very, very important, simple things. Very few side effects, adverse effects of these, and they're rather inexpensive too. So these are some of the stress-reducing techniques that not only for heart patients, but for everyone, namely to avoid having cardiac problems. I think these are very important things. Now, here are some citations that can be available to you later. I think this is all on being taped, so I won't read through these. But let me see. I think I'll stop share.
That's perfect.
Is that right?
Perfect, perfect. See, it wasn't that stressful. So we have loads of really wonderful questions coming in, but before we get to the audience questions, I have one for you. So I had a patient today who said to me after our visit, you all are really practicing psychocardiology. You know, that there's a field of psychiatry cardiology, and the two are so intertwined. And I laughed because I said, you'll have to watch Dr. Blatt's webinar, because that is exactly what we do. And that is how medicine ought to be practiced, because especially in this day and age of the pandemic, all of us, all of our patients are definitely suffering from stress. So as a physician, as a provider, how do you recognize stress in your patients? And then I have a second question, which is, and once you do recognize it, then what? How do you use that patient-doctor relationship to help people manage their stress? Do you have to monitor them differently? Do you treat them differently? But start with perhaps, how can you tell when a patient has stress if they're maybe not forthcoming about that or not even aware of it themselves?
Right, that's a very good question. You know, it reminds me of the conferences that we would have weekly with Dr. Lown. There would be medical students, there would be fellows, there would be residents from the Brigham. There'd be a huge, the room would be so filled every Friday afternoon, and we'd have 2 hours of clinical conferences. And one of the things that was a recurrent aspect of these was Dr. Lown would remind us that when the patient came and said, you know, we would say, well, what is your chief complaint? What is the reason you're here? And he always said, be careful not to mistake the chief complaint from why they're really here. And he said the chief complaint is simply an admissions ticket. It's the admission ticket to come to see the doctor. So you have to have some chest pain, a shortness of breath, and something or other. But really the reason is that there's something going on that is of concern, a source of stress. And that is what the goal of the doctor has to be in order to uncover really how to manage the problem. And not so much treatment, but it's a management approach. And management encompasses the treatment, the prescription one might write for a certain type of drug, but it also involves, well, it's the relationship that first exists. If there's a relationship of trust and the fact that the patient can perceive that the doctor does understand what's going on. This is a very, very important part. This is the basis from which all of the other interactions take place, the therapeutic interactions. Then the advice to take exercise or the advice to meditate will more likely be followed if there's that development of that trusting relationship. But that doesn't happen immediately. That takes a little time. So.
No, that's so true. It can't ever happen right away, can it? And sometimes it's very difficult to do that. Now, I wanted to say that when you describe this evolutionary primitive response of fight and flight, back in the caveman days, of course, it was typically a physical threat, a saber-toothed tiger coming into your cave. And really, it was that reaction of cortisol, adrenaline, epinephrine was meant to prime the body for action, and therefore the dilated pupils so you could see in the dark, and to slow down the digestion so you could focus on running and not going to the bathroom. But nowadays, most of the stressors that you were describing are really emotional or not physical stressors. You're stuck in traffic, you're arguing with somebody, and yet we have this very physical response. And I wonder if you think that some of the things that we do, for example, exercise, are partly to burn off, if you will, those stress hormones that have nowhere else to go. Because exercise, as you point out, I think is really one of the most effective ways of managing all this stress.
That's right. I think you bring up a very, very important element here, and that is, you know, the lion jumping out and attacking us. that's what used to happen, and our bodies have developed and evolved in order to take care of those life-threatening situations. In fact, adrenaline is the chemical mediator for constricting blood vessels. And the reason that that was so important is that back in early evolution, if you were gored by a lion out in the jungle, then you would be threatened with loss of blood. And so somehow the body had to have a mechanism by which it could curtail the loss of blood. And that mechanism was constriction, tightening down of the blood vessel in order for things to clot off.
And clotting factors going up, right?
Clotting. And so it's a mechanism that is highly evolved that in today's world can work against us. And basically a lot of the therapeutics, a lot of the medicines we use are aimed at counteracting that, at relaxing blood vessels that are now so primed to constrict and tighten, which generates high blood pressure, or causing unwanted blood clotting. So we give various types of clotting, clot prevention medicines. And so a lot of what we do now is to counteract what evolution started. So
and of course beta blockers, right, which block partially the adrenaline receptors in the heart.
Precisely. So the beta blocker turns out to be one of the most commonly prescribed medicines that the cardiologists use. It's one of our most commonly used tools, and it counteracts that uninhibited fight or flight response, and it can be extremely helpful in preventing. I know you had a webinar on palpitations that Dr. Ravid gave. Palpitations are very, very common, and often a beta blocker, can be the most effective way to counteract it. Now, there's one thing that I don't want to forget to mention, and that is this reaction that you stated very well. You described it exceedingly well. One of the things that my patients often hear me talk about is the importance of drinking enough water, hydrating. And so I explain often, and I'll try to do it in a clear way, that reflex that is caused by, say, cutting of a blood vessel and bleeding out, sanguinating. That uses adrenaline to tighten down the vessels. So if you're underhydrated, the body sort of senses the pressure within the blood vessels. And so immediately the body starts to say, something might be wrong. It may not be a lion out there, but something's wrong. So it gets on alert, and a little extra adrenaline starts to flow. And that can be, under certain circumstances, the source of palpitations, which can be very uncomfortable. It can be the source of generating angina, chest pain. It can be the source of getting out of breath. It can be a source of a lot of things. And you can turn this all down by simply taking in enough water. As simple as that is, it's something always to keep in mind. And starting early in the day, having an extra glass of water first thing in the morning upon getting up, well, that's a time when our bodies are most dehydrated because we haven't been able to drink for 6, 7, 8 hours. And starting that way, and not drinking at the end of the day in the evening, because then many people have to get up frequently to urinate. But just that simple act of keeping tuned to hydration turns down that stress response. And you manipulate, without taking other drugs, a very, very important response that can work against us. And
Yes.
you've turned it working for us.
Yes, because our body isn't that smart to know what threat is what threat. It's just a threat, right? And I do think, back in the day, people were much more likely to die from low blood pressure, either because starvation, dehydration, bleeding out. And so our bodies evolved all these ways to raise our blood pressure. And in fact, now the problem is so many of us have high blood pressure. But tell us a little bit about, sorry, the relationship between the sympathetic and parasympathetic, the vagal nerve, which opposes that sympathetic drive. How do you engage the vagal nerve to help you out here?
So those two limbs, you can think of them as two lanes in a highway, the sympathetic lane and the parasympathetic lane. One is the accelerator pedal in the car, and the other is the brake. One alerts us to the fight and fight response, to the dangers that may suddenly come upon us. The other one takes care of those more vegetative functions, we call them. Getting a nice rest, keeping the body calm, taking care of digestion, taking care of all of those aspects, making us breathe basically in a consistent manner, mediated in large part by that parasympathetic system. So we are always in a balance between sympathetic, going fast, and then the brake, putting a brake on things and not allowing it to get out of go too fast.
Perfect. Okay. Allison, do you want to, I've been dominating here. Do you want to ask a question?
Well, I'd love to jump in because obviously, this is really near and dear to my heart, no pun intended, but I think your comments about the hydration is a great example of, the lifestyle hack, right? The biohack that I think most people are looking for, right? How can we change where we are without taking medications? And, the hydration piece, the diet piece, the being aware of self-medication piece are all so critical to this. There does seem to be a few questions about diet and how that relates to inflammation and stress. So since we were just talking about hydration, Chuck, I don't know if you want to maybe make some comments about your approach to diet and how that can maybe overlap with some of these stress features.
Well, an immediate connection between diet and stress and the connection that I see involved in water is simply a very easy tool that people can adopt, and that is to have a tall glass of water before each meal. Or when you're feeling hungry and you want to nosh, you want to go take a cookie or this, first have a glass of water or have some bubbly water, fizzy water, and that fills you up a little bit. So it's very easy. There's no gimmicks really, but that can fill you just a bit, and you realize you don't need to eat as much, and there are zero calories. So is that what you had in mind, Allison?
Yeah, well, I think that, so many of us recognize sometimes when we're stressed that we do have a tendency to overeat, or certainly to reach for things that may not be the healthiest, right? If you're having a bad day, you don't usually go grab a celery stick, right? You go straight for that piece of cake. So I think, also just being aware of those patterns, and having a mindful approach to eating, as you're suggesting, where, you recognize, a pattern and even hydrate or maybe, choose to limit yourself to one cookie instead of half the bag, which is, I think, a tendency with stress.
Well, before I forget, because you brought up something very, very important, and that is what we choose to eat depends a lot on how we're thinking, and our behavior is structured from a chemical standpoint. So when you are what you eat, and you eat what you are, and the levels of serotonin and melatonin can be changed by the types of foods we eat. And one of my experiments was to increase the amount of tryptophan, which is a serotonin precursor in the diet, and to see what happened to the electrical stability of the heart. And we were able to show that the heart became more stable when they were, it wasn't a matter of giving tryptophan, but it was foods that were high in tryptophan that reduced the outflow of adrenaline from the brain and resulted in a more stable heart situation. But it's also what's going on within the brain that determines what we think is going to satisfy us. It's such a complicated interaction that it's a very hard thing to get to understand what will work for an individual, because I don't think one approach is going to work for each of us. It's going to be an individualized approach, and I'm very interested in what your approach is. What you recommend to patients as you confront the problem that you brought forth.
Well, I think it is a very individual approach, and I think that point of recognition, right, where you recognize how you're self-medicating for stress is really important. A lot of the things that we eat that are sweet really light up those dopamine centers in our brain. So, the same response maybe, to continually checking your email or eating sugar, right? We get that kind of instant gratification feel that sometimes drives unhealthy habits. So I think, just trying to get to the root cause and recognize your behavior and what some of the stress stimulus is really important to make, progress into modifying our behavior. Because at the end of the day, there's so much that we can control, right? Through everything you listed on that last slide, right? From unplugging, from exercising, to having quality social interactions, right? All those things really make a difference.
There's one other benefit of exercise, and it's rather counterintuitive, because people often feel if they exercise a lot and they do a lot, they're going to be famished and eat a lot. But it turns out that the appetite center within the brain, called the satiety center, it's this bundle of neurons, of nerve cells that are deep within the brain that tell us when we've had enough or when we want more. And it turns out that exercise changes the balance of chemicals within the brain and has an effect on that satiety center, turning down the appetite. So not only are we burning these calories when we're exercising and improving our mood, but it's altering this satiety center, and it's telling us, not so hungry after all, or we feel satisfied with less. One other aspect of this satiety center, while we're talking about it, is that it actually has a latency. That means it takes a little bit of time to be activated as we sit down to a meal. In the United States, we tend to eat very fast, and if we're hungry, we may ask for a second portion before that satiety center has been activated. So if you start to think about these concepts, you say, I better eat slowly. I better slow it down and allow the brain to catch up to the fact that that first portion was enough. And you don't feel that you're depriving yourself, which is great, because there's so many other things that you feel deprived of in life, that this is a way to help to attain your goal. And if your goal is to, say, lose a little weight, become a little more fit, this is a way to achieve that.
That's, I think a nice tie-in for the science, right? On a cellular level, what's really affecting, our bodies from the exercise. So I think, just along those lines, it's nice just to repeat that the exercise kind of counteracts some of those cellular functions that we see with stress, that it can affect your clotting factors, how sticky your blood is, the relaxation of your endothelial walls, your peak blood pressure, your cytokine response, which is cell signaling, which there's a few questions in the chat directly about inflammation. So on a cellular level, these chemicals that are released to kind of communicate between different cells in your body can really be reduced by exercise. So not only reducing your stress, but increasing your exercise, you can really see really positive cumulative benefits. I don't know, Dr. Lewis, you want to chime in with your 2 cents on this?
No, I think that's beautifully said. I don't have anything to add in that regard, except I do want to talk a little tiny bit about sleep, because I think that if you look at those 4 pillars of sleep, nutrition, exercise, and stress, they really can't be separated out, because inadequate sleep raises your cortisol levels, which makes you crave carbohydrates, which makes you not want to exercise. And there's a vicious cycle and a kind of a domino effect whereby you really sort of just want to flip the switch and say, I got to take care of myself here, and approach all those things together. But stress is really part and parcel of that whole constellation of wellness and self-care. And I put in the chat there, I'm trying to answer some of these questions in the chat about foods that contain tryptophan. I put some in there. And you'll notice too that turkey, chicken, fruit, nuts, tuna fish also happen to be very healthy foods for your heart. So the good news is that a lot of the foods that we recommend as part of a Mediterranean diet and part of a heart healthy diet are also helpful for stress reduction. And one thing I would say as well is that foods that have proteins and fats that give you a more steady level of blood sugar, as opposed to simple carbohydrates such as rice, bread, crackers, pasta, that spike your blood sugar, sweets, tend to also mitigate some of those spikes in your stress hormone levels as well.
That's exactly right. We see how we're so connected. There's no, there's no cardiovascular system or digestive system or neurologic system. We are all one. We used to think about this special dichotomy between one's psychologic state and one's physiologic state. And really, there is no difference between these. The physiology of one's psyche is so complex, so interesting, that to me is one of the most exciting parts of practicing medicine. The chemistry of it is so complicated, and it's like unpeeling an onion, because once you get one layer, you get another and another. It's fabulously interesting. But in a way, as cardiologists, we actually have this uniquely privileged position of sitting with our patients and hearing of symptoms, trying to figure out how to approach these symptoms. What do the symptoms really mean underneath? And realizing that there's that artificial distinction between what is psychological and what is physiological, and how one gets to the real root of it, and helping that person. And that's what our goals are as doctors.
Yes, I think for sure we're going to have a part 2 here, because we haven't even touched on, the stories you were starting to tell earlier about rounding with Dr. Lown with a psychiatrist on your rounds team, right? And we don't do that anymore, but we recognize that we've sort of incorporated that into everything we do, because how can you approach a person's heart issue without addressing the whole person, right? You just can't.
That's exactly right. We used psychological stress like we used stress on the treadmill, exercise stress, to see whether a person who has a tendency for serious rhythm problems of the heart, could we expose them under certain psychological stressful circumstances, under control situations, so that we could define a program of medications that would protect them out in the inevitably stressful world that they would, when they left the hospital or leave the office, they would be once again exposed to. And therefore, this was an attempt, and we did this rounding after rounding, and we would incorporate this into our rounds. Back when patients spent a lot more time in hospital, and we had this opportunity to really carefully study them. Now it's a far more complex thing to address in many patients with acute illnesses, because We do it in the setting of the office in a shorter period of time. So we have to be very, very clever about it and figure out new approaches. And that's what we all do every day. We're moving ahead, doing things a bit differently, finding those things that work better and adopting them. And that's the nature of medicine.
Well, one quick question, and then I'm going to let Dr. Kelly Hedgepeth wrap up with the final question. But in the chat, someone has asked, are all cases of elevated blood pressure caused by stress? And in other words, is the right course a beta blocker or a stress reducer?
So is all of blood pressure, high blood pressure, caused by stress? Well, that's a complicated question. I'd say a lot of it is. Stress mediates the same chemicals that we talked about, the cortisol and the adrenaline, that cause the blood vessels to tighten and raise blood pressure. When there's a chronic exposure to these stressors, the blood vessels tighten up and don't know how to relax. They lose that memory of relaxation, tightening up, increasing the resistance of blood flow, and blood pressure rises. And over time, that results in the damage that blood pressure exhibits. Now, the beta blockers can be a very important part of the therapy of a person with high blood pressure, but not always. And sometimes it simply doesn't. They simply are not appropriate. So that's where one has to individualize. Beta blockers can be exceedingly well tolerated, and yet other times very poorly tolerated. I often explain to people that I have little old ladies in their 80s who take 200 milligrams of a pill, and a 35-year-old man can take 2.5 milligrams of the same pill, and they'll be floored by it. So it just speaks to how different we all are. And so beta blockers tend to be exceedingly helpful for a wide range of heart problems, and yet they have to be, again, individualized.
And I think the second part to that question too is getting at the root cause of the stress. Sometimes we can eliminate the need for antihypertensive. So as you have pointed out, an exercise regimen of 150 minutes of aerobic exercise a week can be as effective as that first line blood pressure medication to reduce blood pressure. And there's also a nice review article that's come out in the last 2 years highlighting the effects of meditation on blood pressure. And there's actually about 8 different forms of meditation, some of which are incorporated into regular yoga practice that really are effective too. So I'll just put in that plugs for any patients that are looking to adopt new lifestyle changes in January as we approach 2021 with hopefully enthusiasm and excitement, that there are many things that we can do in our daily life that have profound effect on our blood pressure and our cardiovascular health.
That's right. That's right.
So that's probably a good note to end on. So positive, Chuck. This has been a great discussion, and I think everybody's enjoyed it. I don't think we got to all the questions, so I think we'll have to plan the second part of this in the next few months.
Wonderful. I look forward to it. Thank you very much for inviting me.
Thank you. Thanks, everybody, for joining. 2 weeks from today, we'll be back with our next webinar on it's on peer performance, physical therapy, and movement. All right, great. Stay warm, stay safe.
Happy 2021, everyone.